had told our family doctor that my husband was exhibiting some memory problems, and he asked him a few questions, and my husband couldn't answer them. So he said, let's set up an appointment with the memory clinic.
Memory Disorder Clinic accepts anyone who has complaints about their thinking or memory. Many times I think the hardest things to deal with are when things first start, when someone first becomes concerned about their memory or their thinking, or their loved ones do. The Memory Disorder Clinic is prepared to evaluate them thoroughly, give you a good answer to the problems that are there, discuss any opportunities that might be present to make you better over time, and also to begin the process of teaching you about life with a memory disorder.
70% of the over 450,000 Alzheimer's patients in Florida, 70% of them are taken care of at home by unpaid caregivers. So the more that we can do to support those caregivers is what we're doing really to save money for the state of Florida, to save money for the healthcare system and the long-term care system. And that's one of the goals of the memory disorder clinics. We haven't yet cured this disease. We're really not even very good at treating this disease. But what we can do is help caregivers do their job as well as they can for as long as they can.
The little things that come up every day, all of a sudden, when someone who has been able to be so self-sufficient needed help with the most minor things, and then to constantly be confused about what was happening, where are we going, what is this for, who am I seeing, do I know them? And these are questions that come up all of the time. Even questions about, do I know them when it's a friend that he's known for years and years and years? And, well, the name sounds familiar, but I can't remember.
We deal with very difficult questions that oftentimes we're having to talk to families about issues relating to driving, a very touchy issue, issues relating to care and placement, helping people make decisions about what the right level of care is and how to get it and how to pay for it. And physicians in primary care practice just don't have the time to be able to do that.
I think a mistake that people make sometimes is they'll develop a chronic problem and they'll say, well, here it is, now I can't do this anymore. And they don't try to do anything about it, they just accept it. They don't look for the things that they could do that would put them in a better spot. And when they have to give up something, they don't look for something to replace it. So I think remaining mentally and physically active can become a full-time job when you get older, but it's the right job.
It's sort of bearing your soul, but they are such a help to you. And I think you find when you go to these meetings, you're not alone. And it's helpful to know that others are in there with you, and you can talk it over with other caregivers and the spouses that are afflicted. They make friends too.
The most useful thing the Memory Disorder Clinic can do for patients and their family members is give you a clear opportunity to understand how you're functioning, what's safe, what's not safe, to talk to you about life with a memory disorder that allows you to simply move forward, not to sit around cowering in a corner afraid of the future, but to directly face what the challenges are that are in front of you and to make the most out of the life that you have to live.